All right, I think we can go ahead and get started. Welcome, everyone. Thank you for joining us this afternoon. My name is Kelsey Erickson Streufert. I'm the Vice President of Government Relations and Advocacy for the Texas Restaurant Association. And today we've got a really important webinar for you all on the latest updates that have gone into effect for the Texas Food Establishment Rules, or TFER. These are the minimum standards that apply to restaurants and other food service venues across Texas. There aren't a ton of changes, but there are definitely changes that we need to be aware of so that all of our restaurants remain in compliance and continue to keep their customers safe. So with that, couple housekeeping items. If you have questions, please submit them in the chat or Q&A box. Our folks will be monitoring the Facebook live feed as well. After our presentation from the Department of State Health Services experts that we have with us today, I'll take a look at those and we'll get through as many of the questions you've submitted as possible. And with that, I think we'll go ahead and kick this off. So really excited to have Jason and Jaime join us today from the Department of State Health Services. I'm going to kick it over to them and have them start the presentation. Thanks for joining us.
Oh, thank you, Kelsey. We appreciate the invite for Texas Restaurant Association. As Kelsey said, not a ton of major changes to TFER, just some of the methodology and how we adopt that rule. But again, my name is Jason Guzman. I'm the lead training officer and standardization officer for the Public Sanitation and Retail Food Safety Group, which is a unit under the Texas Department of State Health Services. I'll let my other colleague, Mr. Jaime Sepulveda, introduce himself as well. Jaime, you're on mute, sir.
Oh, thanks, Jason. Can you hear me now? Yeah, all right. Yeah, my name is Jaime Sepulveda. I'm one of the compliance officers with the Public Sanitation and Retail Food Safety Unit, and I'll be helping out Jason Guzman with the presentation today.
And Joe, would you like to introduce yourself as well, sir?
Yes, thank you. Thank you, Jason and Jaime. Thank you, Kelsey. And we're happy to be here today. As Kelsey said, you know, we've had a new version of the TFER that has gone through the vetting process and become effective on, I believe it was August 2nd. There are changes, but there's not that much that's changed at ground level, I guess I would say. And Jason will explain that more as he goes through the presentation. But welcome everyone, and we hope that you get something out of this presentation, and we'll be happy to answer any questions after Jason and Jaime have completed it. Thank you.
Thanks, Joe. Let me see if I can share my screen here. Can you see that, Jaime?
Looks good to me.
All right, perfect. So again, Texas Food Establishment Rules, or TFER for short, these were last updated in 2015 with a lot of changes. So I think there's been a little bit of confusion due to that last update of 2015 and now in 2021. So in 2015, I think we had probably about 150 changes with the rule set due to the rule not being updated for probably about 10 years. However, if we can actually stay on par per the department and some of our rule development, there will not be that many changes as if we can stay up on the rule. So we'll kind of go over some of the major changes and give you guys a little bit of background on some of those rule changes as well. So the first slide we have here is just a quick statement. The presentation is going to contain a lot of information about what has actually been updated to the Texas Food Establishment Rules. The biggest thing is we want to let you guys know that it's not going to cover every detail. So it's really more of a general information only presentation. We usually don't recommend reproduction of this type of presentation since it's so general. However, we'll give you a lot of resources where you guys can funnel back to either the DSHS website, to the Health and Safety Code, to the Texas Administrative Code, so you guys can actually find the actual content itself in its entirety. Quick resources, just in case if you guys get a little bit lost in the presentation, you can always go to our web pages for a lot of great resources. So the first one is our DSHS Retail Food Establishment page. It's going to go over basically the TFER 101, and it's going to give you the posting to the Texas Register, which goes to the Texas Secretary, as well as the adoption packet and the actual Texas Administrative Code web link as well. Right underneath there, you're going to find our regulatory clarifications and documents. So this is where we post most of our guidance documents, usually pertaining to the rule set, as well as inspection reports that are being conducted under DSHS jurisdiction. The example, those screenshot I have there at the bottom, anything where you guys see 2021 in it is going to state the year that it's posted. And then basically you'll see a small note to the right of it, basically saying it's new and the date. Questions, as Kelsey said, so I think I got you guys for about an hour. I'm gonna try to get through the content itself, the bulk of the training material, in hopefully about 45 minutes. And if we can, we're gonna take questions at the end of the presentation. We are a state agency, so we love our acronyms. So just in case if there's anything that I might use an acronym, here's just a quick list. And I'll make sure to get this presentation out to Kelsey if there's any other acronyms I used within the presentation. The big ones that we might talk about today, of course, DSHS, that's our agency that we work for. Consumer Protection Division is the division of where our unit falls. And then Public Sanitation and Retail Food Safety. We are the unit that's actually designed to update specifically the TFER, as well as a few other rule sets. SB, we're going to talk about a specific Senate bill that kind of initiated the rule update. And then if we do talk about the FDA Food Code, we usually just abbreviate it to Food Code itself. Okay, so a little bit of background, just so there's no confusion. The state of Texas is what's called a home rule state. Basically, there's an amendment in our state constitution that grants cities or municipalities the ability to pass laws to govern themselves as they see fit. So as you'll kind of see with one of the other examples I have here is that the state of Texas is probably got 190 to 200 jurisdictions across the state of Texas. So it's really going to be dependent on where your food establishment is located. And then, like I said, working with that health department to see what either municipal codes they have in place or orders through the county or public health districts. And I'll kind of explain that a little bit further. So with home rule, some of the public health agency structures that you might be working with or working within would be DSHS. So we are a state health program that acts in place for smaller jurisdictions that don't have a health program. So we do probably about 190 counties here in the state of Texas that don't have a retail food safety program. So we have about 40 inspectors that are spread across the state that provide that service, very similar to the large municipalities. We have county health departments. I think we have a chapter of TRA that is in East Texas. So Harris County is one of our bigger programs. So they will cover all of the food establishments within that jurisdiction of Harris County. Then I use or Travis County. Then I use city health departments. These are going to be your large municipalities. San Antonio, Dallas, Fort Worth, El Paso. They are their own health program. So they'll have their own municipal codes for enforcement of food safety within those jurisdictions. Then we have health districts. So this is basically when counties and cities pool their resources together to provide that service. So maybe they're lacking some financial support individually. So basically they work as a team to provide that service within that set jurisdiction or public health district. So just in case if you're listening in and you don't know who your health program is or who your health department is, We actually have a really handy interactive jurisdictional map on our DSHS main page. So this is using some GIS technology, but basically anything in yellow is going to be specific to DSHS, and that will be the state program that will provide food safety for you guys. However, anything in green is going to be a little bit more specific to either a county or local program. So this is the interactive map. So you can actually zoom in depending on what area of Texas you're in. I think I used Houston as the example here. But as you zoom in, it'll start to break up those jurisdictional lines. As you can see, most jurisdictional lines are not a perfect circle. So this is kind of to help you on what side of the street you're on, what side of the city you're on, just to make sure that you're speaking to the right health program. And then this example, I use Harris County. If you actually click within that jurisdictional region, it should give you some contact information. A program where you guys can call them in case you have a complaint or if you have questions about food safety specific to that program. So laws and rules. So Health and Safety Code 37, it's going to really break out those jurisdictional lines. So there is clear differentiation between municipalities, health districts, county, and the department. So the regulatory authority who's going to be licensing you, inspecting your food establishment is going to be very important, but it's going to be specific to where that food establishment is located. And we'll kind of get into why that's important. So one of the big questions we've been getting probably this month is when everyone is starting to become aware that the rules are now effective. So if you're not aware, the new TFER rules went into effect August 8th of 2021, as Joe kind of mentioned. The biggest thing is people are wondering when is implementation of these new rules. So that be specific to the jurisdictions where your food establishment lies. So implementation by those jurisdictions is going to be based on their own rule adoption processes. We'll give you an example of how DSHS does theirs and how it's a bit elongated. Theirs might be the same, it might be quicker. So in case you guys, if you have questions on when these new rules are going to be implemented, please contact your local health program, and then they can give you a more specific timeline on implementation of those rules. But yes, they are in effect, but it takes government agencies some time in which to implement that rule. So for DSHS, specifically talking about the TFER rule that's been currently updated, I won't get too much into the detail, but it's a pretty elongated process. We actually started this process probably late 2019, and then we were working through COVID, so we had to push out some of our informal comments as well, so we could actually get people aware that we had a rule in draft. So how it usually starts is we have a working draft in our office. So the program itself has the ability to revise rules as set by the standard, which is usually about every 4 years. So we were hitting right on that timeline since the 2015 and then in 2019 for the update. However, the rule development process, as it is elongated, took about 2 years to come into effect August 2021. So usually with that working in-house draft, it goes into an informal comment period. So we start usually having usually in-person stakeholder meetings with individuals, usually our regulatory agencies, large and small, as well as some of our stakeholders, large corporations, as well as smaller restaurants as well. Unfortunately, with COVID, we weren't able to have a lot of those meetings, so we were able to utilize the Teams webinar platform. So I actually think we were able to encompass a lot more people within those stakeholder meetings. Once it actually goes through those stakeholder meetings and formal comment period, it goes into proposed rules phase. Then it's open for an official comment for 31 days. So the register will post it, notifying everyone that, hey, we have a rule that's about to go into proposed phase and then a finalization. Once it gets past there, it goes into final approval and authority, all the way up to Dr. Hellerstedt, Commissioner of DSHS, then all the way up to the governor's office for signature. That the rules are going to be in effect and pass through. Once we get that through, it goes to the Texas Register. They will usually give us a final adoption of the rule and then an effective date based on the rule. If you're not aware, we actually had 2 informal comment periods due to COVID. So usually the informal comment periods are only about 2 weeks. So our first one was April 27th through May 11th. We had a few comments that, hey, you know, we're handling COVID situations. Is there any way we can get more time to review this draft rule? So we actually requested it and we got it approved. So we posted it again for an informal comment period from September 8th through the 30th. The informal comment period affords a lot of comments between the stakeholders and some of the issues they're reading with the rules or questions they have with the rules. We're usually not mandated to actually respond to a lot of these questions. However, we had some regulatory agencies as well as stakeholders really confusing the intent of the new methodology of the TFER. So we actually posted a question and answer on our website, and it was up there for probably a good 4 or 5 months, kind of talking about some of the 20 major questions we were receiving during the informal comment period. And like I said, when we posted it for the second formal, I don't think we had maybe a quarter of the total amount we had from the first informal comment period. Once we got past informal, it goes to a formal comment period, which was April 2nd. That's actually opened up for 31 days for formal comment and response from the agency. So if you actually go to the Texas Register issue April 2nd, 2021, you can actually see the finalized rule in the Texas Register as well as the comments that we responded to during the formal comment period. Okay, so the DSHS updates, this is what everybody's kind of here to listen to. So if you're not aware, these rules were finalized and went into effect August 8th. As we talked about, implementation is going to be based on the jurisdiction, but just be aware there are some updates to the rule. So as we talked about, we started the process in 2019. It didn't go into effect until 2021. Some of the major issues that or topics that we're going to kind of talk about today is that food safety, it hasn't changed. We just added some new rules that update the science of some of the rationale of some of the things that we're doing already. However, one of the major changes that regulatory agencies as well as stakeholders are going to have to get used to is that we kind of changed the method in which we adopt those rules. We used to use a methodology called transcription. So it's a fancy word for copy and pasting a federal guidance document into the Texas Administrative Code. It's a bit of a cumbersome process. So we were looking at some of the other consumer protection units and how they adopt some of their rules. So what we're going to do now is that since most of that document is a transcription of the FDA Food Code, we're just going to reference that larger document. So the TFER, if you guys have ever opened it up, was about 168 pages. What it's going to kind of slim down to is about 30 pages. So what the TFER is really going to hold now are the Texas-specific rules due to state statutes that are going to be in the TAC itself in Chapter 228. So it's going to be a little bit shorter. It's going to be only Texas-specific rules. And then a majority of those food safety regulations that you're enforcing already on a routine basis are going to be found in the FDA Food Code through a reference. So if you've never actually looked at the FDA Food Code, I'll give you a link to that. You can open it up and we'll kind of talk about some of the advantages of the FDA Food Code versus the Texas Administrative Code and how you guys can use that tool. So local jurisdictions, county programs, they're going to have to change some of their municipal codes and ordinances referencing that new document. So that's where some of the process is going to be a little bit slow. Some of the major changes, if you're not aware, is the person in charge equals the certified food manager. Many local programs are already enforcing this through their own ordinances. However, what FDA did is that now there must be a certified food manager during all hours of operation. The minimum standard before that was that you just had to have someone employed. He or she didn't have to be there on site, assuring food safety. They just had to have a certificate and someone had to have taken it. With a PIC that always has to be there during all hours of operation, this is going to push that certification requirement. So whenever there's food operation going on, that there has to be someone there that's a certified food manager. Cook durations. So, there's different cook durations for pathogens of concern for different proteins. So there were some changes to some of those cook durations. There's a new section specifically in TFER that talks about pets on the patio. So we had a lot of local jurisdictions using what's called a variance process to actually allow pets on the patio within their municipalities or county health programs. Senate Bill 476 during the 86th legislature actually passed a law that sets a minimum standard around pets on the patio. We'll talk about some emergency operating plans, some new language that allows for continued operation, usually during a interruption in water or electricity. And then we'll also talk about the inspection report that was previously in the rule that's been removed. FDA Food Code, we'll give a link here in a minute to that actual document. But if you guys have never opened the FDA Food Code, it's got a lot of great information. It's a lot easier to read as well, since it's actually designed as a training tool. But it also has annexes, it has guidance documents for employee health. So we're hoping by introducing this document as a rule now, it includes some of those helpful guidances that are part of the annexes. TFER, so we have a lot of guidance documents that are on our webpage right now, so we're slowly updating those. But one of the ones that's probably the most popular between some of our stakeholders is going to be the quick reference guide. So we've updated those quick reference guides so you guys can use those within regulatory or industry. So you guys can see where the citations go and what is the intent of that citation. So Senate Bill 476, this was actually in the 86th legislature, not the most current 87th. But basically, they passed a law that amended Health and Safety Code 437. What this actually did, it basically sets a minimum standard for dogs on outdoor dining areas. So the biggest thing is that it's going to be a little bit restrictive for some of the municipalities that were approving variances within those jurisdictions. So the statute is very clear that it doesn't allow the municipality to enforce basically a more stringent ordinances. So what jurisdictions are going to have to do is look at their ordinances for pets on the patio, specifically dogs, and they're going to have to modify to the statute now. As a owner, as an operator, I think the biggest concern was, do we have to allow pets on the patio? It is not mandatory. However, if you are going to allow pets on the patio, there is now a statute that's in law now that sets that minimum standard. So what we did in the TFER, we actually just took that statute and just put it into the actual rule set. That way it mirrors it exactly word for word. And this actually went into effect September 1, 2019. So some of you guys may be aware of this already. Okay, so FDA Food Code, the FDA updates the food code probably every 4 years, depending on process. Sometimes there is some lag. But what we've done, the previous version of TFER was actually a transcription of the 2013 FDA Food Code. Now that we're going to reference it, we'll reference the most up-to-date FDA Food Code, which is the 2017. So if you guys actually, you can either Google search it, or if you want to hit that link or copy that link into a URL, and it'll take you straight to the FDA Food Code webpage. And you guys can actually download that food code into a PDF. And then you guys can save it on either your smart device or your laptop. So one of the major changes from the rule set from 2015 to 2021 was the inspection report. So what we were seeing with the current rule set is that we had a lot of jurisdictions really not utilizing the report that was in the rule set itself. So what we decided to do was to remove that inspection report from the actual rule language. So some jurisdictions, it's going to give them some flexibility to either create their own inspection report to use with their industry stakeholders and the food establishments under their jurisdiction. However, many of them are going to continue to use the same inspection report. So by doing that, there was some concern about uniformity with some of the restaurants and some of the regulatory agencies. So our biggest stance on the inspection report is that is just a document to where observations during your routine inspections or compliance inspections are notated. So the rule is where the uniformity needs to be. So we're going to continue to provide guidance documents on intent of citation, on intent of food safety rationale. Again, the inspection report will be specific to the health program. So this is the old 47 item form. You're going to have many health programs that are continuing to use this if they deem it necessary. DSHS, for example, we're going to expand to a very FDA similar inspection report. So we're updating some of our guidance documents for those jurisdictions under DSHS. So if you have questions on the inspection report, what the jurisdictions are going to be using, again, reach out to the local health program, see what they're doing, and then they can give you some information on what inspection report is being used. Okay, so the next slide, this is the major changes as we transcribed the previous TFER edition. The major changes from the FDA 2013 to the most current FDA 2017 were pretty minimal. There wasn't a lot of change. So I know the methodology and reference versus transcription is going to be a bit of a change. However, what is actually changed in food safety within that document is very, very small. So this is actually the only, I was able to actually consolidate it into one slide. So as we kind of talked about before, FDA has added some language on the person in charge being the certified food manager. That's one major change there. They've also added some new responsibilities to the person in charge within that duties and knowledge section of the rule set. So there is now a requirement for employees to routinely monitor food temperatures during hot and cold holding. Many of you guys do this already. However, now it's clearly stated in the rule. I think the only question we've gotten on that one is it going to require logbooks? There still is no language specifically mandating logbooks for your hot and cold hold units. However, it is still strongly recommended. However, when the person in charge is, when the inspection is usually going on, they're going to ask questions of the person in charge on how that's being done. So make sure you guys you have that process within the food establishment. Revised descriptors. So this is more specific to employee health and then the knowledge and then how you guys are actually writing up some of your employee health policies if it's required. FDA kind of used some different terminology within the previous document. So what they tried to do is kind of reorganize it to common terms. So that way it's not different throughout the document. So for example, Salmonella typhi or S. typhi, you're going to find it in the new 2017 FDA Food Code, typhoid fever, and then bracketed caused by Salmonella typhi. Same thing for non-typhoidal Salmonella. They just kind of changed that descriptor a little bit, but it's still speaking to the same bacterial foodborne illness pathogen. There's a new section that talks about use of bandages and finger cots or finger stalls. So this is usually if you have employees that have been injured, usually in the hands or arms. And then it talks about the requirement for basically an impermeable cover so they can actually wash that hand or arm if they're actually in food preparation. So there was actually previous language in the rule set that kind of talked about this, but FDA actually created, it's kind of a standalone section speaking to it. So it's something that was kind of already being done within food safety and restaurants already. Cooking duration. So I don't think these have changed in probably about 20 years. So they were able to use some of the USDA charts for some of our large meat manufacturers and use some of the science for cooking durations. So anything like commuted meat, hamburgers, stuff that you guys are grinding up, used to have a temperature of 155 for 15 seconds. They've done some science that said, hey, it probably needs a little bit more of a cook time to actually kill the pathogen of concern. So that they're pushing that out from 15 seconds to 17 seconds. For poultry, they kind of went the other way. So for poultry, turkeys, ratites, it was at 165 for 15 seconds. Again, they've done some science background. So basically the new requirement is 1 second or instantaneous. So once it hits 165, you have killed the pathogen of concern. So you don't have to actually, keep that thermometer in that poultry product for 15 seconds anymore. They have some new requirements for cleaning agents and sanitizers. So there was, from a regulatory standpoint, we'd go into routine inspections and you may not be cleaning or sanitizing at that point of the operation. However, there's now a requirement that they must be available at all times. So even though you're not going through that cleaning process or sanitization process to be verified by that inspection, they must be available. So if we walk in and there's no sanitizer for the ware washing machine or the manual 3-compartment sink, that would be a new violation that can be notated. So you want to make sure that you always have those supplies readily available when you guys start to do that sanitation or cleaning process. For any of the food establishments that have a HACCP plan, there was some revisions to some of these information required from the food establishment for the HACCP. We looked at them a few different ways, probably more than 100 times. It's really speaking to the same information. They just kind of reorged it a little bit. However, if you guys do have a HACCP plan with a regulatory agency, I would recommend reaching out to them just to make sure that they don't, they're not going to require something else with that HACCP plan for approval or continued approval. And then last, we'll get into continuing operational plans in case of an interruption in water, electricity. I actually have a slide a little bit further down in the presentation that will go over this in a little more detail. But basically, this would allow a food establishment with a pre-approved food safety plan to continue operations, usually with something that would cause them to usually close immediately. So if you have that pre-approved plan with the health department and it's been approved, it would allow you to remain in operation. So those are the major changes from the 2013 to the 17 Food Code. So like I said, there are some summary of changes, guidance documents on that guidance and publication webpage. We'll get a little more in detail on every comma and semicolon and all that stuff. But these are the major changes that you need to be aware of. So what we're going to do now, because we changed from a transcription or copy and paste to a referencing of that document, the TFER is going to look a little different. So I'm going to go over the subchapters on what were the major changes within the subchapters A through J. So if you guys ever reference the TFER, you'll kind of understand what is in there and what we've done. So subchapter A is going to be our general provisions subchapter. This is where you're going to find the reference to the FDA Food Code. So this is where we're mandating it within the rule that we're recognizing that guidance document from FDA as a rule within the state of Texas. So this is where you're going to have to get a little bit comfortable reading that document. And I'll give you guys some examples, but we're really sold on that. It's going to be a little bit user-friendly as it has some more tools that it can use for the reader to understand what he or she is reading for food safety. But if you're looking for where is that reference, it's going to be in subchapter A 228.1. So the definition section, so subchapter A is we're going to find all the specific terms within the TFER. So because we're referencing that FDA document, there was a lot of repetitive definitions. So a lot of those definitions, it's going to look like they're not there anymore, but they're just going to be in the other document. So where the TFER had 152 definitions, there are really only about 30 specific TFER definitions that need to be in there. And then everything else can be referenced within the actual food code itself. Some of the definitions are a little in conflict with some of our Texas statutes or some of our state-specific rules. So there are a few definitions in the FDA Food Code that we cannot recognize just based on Texas rules and laws. So things like accredited program, drinking water, food establishment, those definitions are going to be clearly defined in the actual TFER itself. Some new definitions that were added into the TFER is going to be common carrier, cottage food operation, and FDA, they only added one definition within their new document for the 2017 Food Code, which is intact meat. So for common carrier, if you're not aware, this is going to speak to anyone that is going to transport food or people. It is now defined as a type of food establishment. We didn't write too many specific rules for this new definition. However, it will allow some flexibility within the jurisdictions if they deem it necessary to actually possibly permit as well as inspect these common carriers. So every program is going to have different resources, different focuses on food safety. However, please be aware that there is this definition and it is possible for a jurisdiction to enforce a minimum standard upon it. Cottage food operation production, that is a huge new evolving business within Texas. So this is not in any way to include it as a type of food establishment. Cottage food is still unregulated and from a home processor. It is only in the actual TFER for clarification of that food operation. So there's no confusion. So it's a clarification definition. And then for FDA intact meat, they have some more detail on, commuted meat, injected meat, specifically speaking to that type. And then there's regulations set around that type of meat. Central preparation facility and event. These are definitions that were in the old TFER. They're still there. We just edited them a little bit to kind of streamline some of those definitions to get to the, cut straight to the intent. So if you are a central preparation facility or you're a temporary food establishment and you go to a lot of events, please be aware that those definitions have been revised. Food establishment, because we have some state-specific food operations like cottage food, we have to have a state-specific definition for food establishment. So it's going to be a little bit different from FDA's. The food establishment definition was updated for formatting and then to include those Texas-specific rules and regs. In the TFER, we also had a lot of repetitive definitions. So here's just a quick list of definitions we removed. So for example, I'll try not to go through all of these, but we had about 4 definitions for the same terms. So we had a permit, we had a permit holder, and then we had another 2 definitions for license and license holder. So we kind of went back to our Texas Administrative Code to see what term we actually used. So we removed license and license holder since it was a repetitive definition within the rule set. However, if there is confusion on if a permit is a license or a license is a permit, we feel like the regulatory agency can usually provide guidance, either post it to the website or through clarification within their programs. So this is what we've kind of done through the rest of the list. We have a lot of repetitive terms as well as self-descriptive terms like bare hand contact that we were creating definitions for. So those things like bare hand contact, common dining room area, we feel like they're descriptive enough to where a definition is not needed. So many of these have been removed from the TFER, and you won't find these in the FDA Food Code as well. Subchapter B is going to be the management and personnel section. So this is where you're going to find the new addition from the 2015 TFER, speaking to posting of a certificate as well as the food handler certification requirement. So we introduced that in 2015 and it went into effect, I think, September 2016. So the only change that we had on the food handler certification is the training course in which to obtain it for the employee side. So it's actually gone down. It originally was 60 days. It's going down to 30 days now. So if you have a new employee, he has that 1 month period in which to obtain that food handler certification. If he doesn't obtain it within that time frame, there's a violation as that he's elapsed that time. This is kind of mainly due to the influx of food handler programs since the addition of this language in 2015. So I think we have probably 150 programs now, specifically here in the state of Texas, that are accredited. And we still have our national accreditation bodies like ANSI that accredit the national food handler programs that have reciprocity across the nation. These really range in price as well. So we've seen as low as $1 to as high as $25, depending on that program. So we really feel that it's 30 days is a sufficient amount of time in which to obtain its certification, and there shouldn't be any kind of financial barrier since there's programs that are really fairly reasonably priced. Remove some of that language about the previous effective date. Subchapter B is also where you're going to find one of the new signage requirements. So there is actually a requirement now for reporting symptoms and diagnosis signage at the hand wash station. So if you guys remember your employee health policies, there are diagnoses that the employees need to actually speak or let the person in charge or management know about, as well as if they're diagnosed with one of those big 6 foodborne illnesses, to let their manager know, and then they take corrective action on to either exclude or restrict that employee from the food establishment. This sign is basically going to notate that information. This is actually a guidance document that we've had on our webpage for quite some time. Some of the local health programs might use something very similar, if not the same document. So just be aware that, if there's any specific signage that the local program has, the rule actually speaks to this new sign that is required at the hand washing stations. The intent of this is really to notify employees, kind of educate them a little bit more on that employee health policy. That way they're aware that, hey, I have jaundice or I've had vomiting and diarrhea this morning. I need to let my person in charge know. So he or she can make a determination on what's the next step. That way we don't have any issues with foodborne illnesses. Subchapter C is going to be our food section. So we just had a few revisions on terminology so we could reference the FDA Food Code. So we changed some of the compliance for approved sources languages in the rule. So previously, to be an approved source, you had to be permitted in an inspected facility. Unfortunately, with Texas laws, there are some statutes that are in place that you are an approved source, but you may not be licensed or inspected. So what we've done is use a more broad term to compliance with food law. So as long as they're in compliance with Texas rules and statutes, that is an approved source under the TFER. We have some state-specific temperature receiving requirements, as well as fluid milk and milk product citations. So we actually changed some of that language versus FDA and cited the Texas-specific citations. For the eggs being received section, we actually specified chicken eggs, as it is the only graded egg here in the state of Texas. There was a lot of confusion with a lot of other type of poultry eggs that are being sold in retail. And then we had a lot of regulators trying to cite those specific citations when it really doesn't apply here in Texas based on our own programs. We changed that language to be specific to the chicken eggs and the grading that is actually done here in Texas. Frozen milk, show stock identification. There were, again, some Texas specific citations that we needed to update. So we put those actually into the TFER versus referencing that FDA national citations. We still have the buffet notification sign. That's actually Texas specific. So that's still a requirement within the rule. And then our donation section, which is also another Texas specific rule, has been updated. We added some language for some of the share tables that we're seeing in some of those schools. Some of the regulatory agencies, we're seeing some conflict with TFER and then allowing some of these share tables. As the intent is to kind of feed children that don't have the ability to, buy lunch or feed themselves. We tried to add some minimal guidance there so it's not in conflict. It's basically an exemption that can allow those share tables if they stay within these minimum food safety parameters. So you'll find that in the donation section that's been updated. Subchapter D, this is our equipment, utensils, and linen section. We're gonna basically hold this subchapter in reserve as the entire subchapter was referenced directly from FDA Food Code. There was nothing state specific in this section. So just in case if the next revision of FDA Food Code has something in there that we don't agree with or something that's been added, we held it in reserves in which to make further revisions if needed. Subchapter E is going to be a water, plumbing, and waste section. Jaime, did you want to go over this one, sir?
Sure. Yeah. So basically, we'll talk about this more in Subchapter J and how we changed about that. But we changed the way we're going to provide or those requirements for those non-public water systems or for those facilities that don't meet the definition of a public water system. But I'll elaborate more once we get to Subchapter J. Some other things for mobile food units, there was some kind of redundancy in the water requirements for those mobile food units or food trucks. So instead of having that information for those requirements of water for those mobile food units in Subchapter E, we moved all of them to those specific facilities for mobile food units. So instead of having them both in Subchapter E and H, we just moved all of them for describing the requirements for mobile food units. That's about it, Jason, on that one. It's pretty quick on that.
Yes, sir. Appreciate it. As Jaime kind of said, so Subchapter H has always been our specific food establishments for Texas. So we have some specific language for mobile food units, temporary food establishments, self-service food markets, temporary events. So don't get this confused. This is that minimum standard rule that Kelsey was kind of talking about in the beginning. Municipalities, they might have more city-specific regulations for those operations. So usually they'll write those within the municipal code. So if you're looking for a city-specific regulation that they're enforcing, that's a little bit more stringent than the minimum standard of TFER, you're going to find that within their municipal codes. That's Subchapter H. Subchapter F is going to be our physical facility section. I think the major change you'll see here is, of course, going to be our pets in the patio. This is going to be reflected in our new section 228172. And it's going to speak to dogs in outdoor dining areas. And it kind of sets a minimum standard of what they can actually do within those areas. So if you haven't read the statute, this is specific to canines. It doesn't speak to any other type of pet, but it will require the food establishment to post signage in a non-conspicuous location in the area that the dogs are going to be allowed. The customer and the access of the animal have to be directly from the exterior, so they're not allowed to come through the food establishment to go to that patio area. The customer has to keep the dog on a leash and control it at all times. The customer cannot allow the dog to sit on tables, on his seat, the countertop, and then definitely we don't want them in food preparation areas within the food establishment. So we have a lot of patios now that have a lot of dining on the outside. Some of their brunch and dinner sections, dinner rushes, excuse me. So you got to be careful on where those animals are being set around that area. So again, more questions. If you have something specific that you're kind of encountering because you want to do this correctly or you want to understand the new rule, please reach out to your local health program and they can give you some guidance on what they'll be looking for during those inspections. And the biggest thing to kind of remember with pets on the patio, it's specific to dogs. This is not speaking to service animals. Again, service animals are already in the rule set, already recognized as an exemption to the prohibition of animals. This is something kind of state specific, allowing those dogs on those outdoor dining areas. And then the only other real major change within Subchapter F is going to be the language that we added in 2015. So there's been a lot of back and forth between a term that we added in 2015 called light and color, specifically for walls, wall coverings, ceilings, speaking to, you know, basically the wall paint or the opacity or the materials being used within those surfaces. So we actually did a kind of a survey within Texas to some of the regulatory agencies to see how they were enforcing this light and color. And it was a little bit specific to some programs and a little bit more range in different areas. So we've added some language to kind of clarify some of that stuff and hopefully help some of our stakeholders if the program is kind of sticking to the statute or to the rule, excuse me. So what we've added is underlined. So those surfaces still have to be light in color or meet the requirements and approval of the regulatory agency. So we're not trying to take the regulatory requirements that are in place already away from the regulatory agency, but however, we want to allow them some flexibility if they thought that language was too stringent. So what we've added is B to the section that talks about darker colored coverings, specifically to those walls and ceilings and wall coverings that can be used. However, additional lighting will be required within those areas when needed for cleaning. So what we've kind of added some language for is to allow that jurisdiction to kind of set that parameter within those areas. So the best example I usually give is like the bar area of a food establishment. Usually there's darker paint, surface material being used in those areas. However, at night, they're going to close that establishment. They're going to need to turn on the lights in which to finish cleaning. So again, the lighting requirement for that area is going to have to be slightly increased from the minimum standard. So hopefully this kind of has a nice medium between the regulatory agencies and some of our industry partners that want to use different types of materials within the food establishment. Subchapter G is the, poisonous or toxic material section. The only thing that we actually added in 2015 to TFER was the requirement for a first aid kit. Most food establishments already had this, so it's really just kind of covering a very small population that didn't have them in place. So this is the only state-specific rule that we have in this subsection. So it is still requirements. There's been no movement on the supplies themselves. I think we tried to actually incorporate a list of supplies on the original inclusion in 2015. However, there was a lot of pushback on that one. So it's a general first aid kit, and then we have guidance documents talking about the necessary supplies. So usually regulators are going to look for minimum stuff in there. However, if there's only one Band-Aid or one gauze, that's usually when they'll cite the regulation and then provide the guidance document. Subchapter H, as we kind of talked about, these are the Texas-specific establishments. We didn't really change a ton to this section outside of reorganization. So we had some, as Jaime kind of talked about, some repetitive language for mobile food units. We eliminated the repetitive language. It's still a requirement, specifically for readily movable mobile food units. It'll be found in one location citation versus multiple areas. We reorganized the bed and breakfast section. There was a lot of confusion between our industry stakeholders as well as our regulatory stakeholders on a bed and breakfast extended, a bed and breakfast limited, as well as a bed and breakfast food establishment. These three categories are actually defined in statute and law, so that they have to remain in the rule. So what we did within DSHS, we tried to reorganize them a little bit so it's a little bit easier to understand. However, it's the same intent, just reorged for ease of use. All right, so subchapter I, compliance. It's going to look like a lot of changes were actually done in here, but just so you have a little bit of a background, when we were transcribing the FDA Food Code compliance section into Texas Administrative Code, we left out a lot of stuff already. So what the intent was we were trying to do is reflect what the type of compliance section we have now using the new TFER. However, because we didn't include a lot of that stuff on transcription, you're going to see a lot of stuff that's not recognized in the TFER by eliminating that citation that's referenced in the Food Code. But the intent was really to maintain what we're doing now in the compliance section with some small alterations, and we'll kind of talk about that. Because we removed the inspection report, there's not going to be the need for a demerit value. So we have a lot of local programs that like to use a scoring system within their jurisdiction. The TFER really never outlined scoring within the inspection report. We actually use what's called a demerit system. So what most programs usually do, they take a 100-point scale and they subtract those demerits to equate your percentile. So that's something that we're kind of doing on their own. It really wasn't outlined within the actual program rules in the TFER. So usually they're doing that through municipal, city council, municipal code updates as well. So we remove that since there's no inspection report. Will they still use a scoring system within those jurisdictions that are using them? They can, but again, it can be based on their own internal policies. Again, it was never really referenced in the rule. So as we eliminated the inspection report, it kind of didn't need to be there. We have some trade secret language that's specific to some Texas citations, so we updated that one. And then of course we had some construction pre-operational inspection language that's in the current, that was in the previous rule that's still there. So it talks about, if the jurisdiction can do it to require a pre-operational inspection. Most larger health programs are already doing this already. So it's really more specific to DSHS. In which we can or cannot, or we can or may not do a pre-operational inspection. There's a lot of language in the actual FDA Food Code that talks about application requirements and what information is needed on there. That's never actually been in the TFER, so that's not going to be referenced, as most programs will set the minimum requirement of what information is needed for their industry partners and stakeholders. Same thing for issuance requirements. Inspection frequencies it has always been Texas specific. So FDA actually has a pretty stern requirement for frequency of inspection. TFER has had language since 2009 about allowing either a shortened frequency or an extended frequency based on the operation and its history. So we kept that language in the TFER to allow jurisdictions based on their resources, their food operations, to set that standard on their own. Okay, so competency of inspectors, that's probably the big one on here. So there actually is a food safety credential that's required of regulatory agencies. That certification actually moved to a different state agency. So it moved from DSHS to the Texas Department of Licensing and Regulation. So we just updated that citation to reference the professional licensing area. We changed some of the terms. We had some language in there talking about inspection order. We actually don't use that language in any of our Texas administrative codes. So we replaced that language with health warrants, just to be in line with our own regs. Refusals for notification, right to access. This is language that is probably going to be more specific to the health program. So we remove this information from the rule. For example, if you guys refuse inspection from the inspector, they should have policy and procedure in place on what is the next step within their regulatory agency. The rule was a little bit too stringent that we didn't think a lot of regulatory agencies could comply with that. Investigation and control. This is actually a large section that kind of regurgitates the employee health section of the rule. This was actually never in TFER, so we removed it to kind of stay in line. And then 228257 was communicable diseases section in the actual TFER. We had a lot of regulatory agencies using this during COVID. So we kind of had to look at the citation a little bit closer. And the citations that were referenced within the site in this section were actually not specific to food establishments. They were more focused on medical staff. So we removed this section. But also, as COVID is not foodborne driven, we didn't feel it was pertinent to be in the food safety regs. We feel like there's probably epidemiology, there's other health rules within municipalities and counties, as well as the state of Texas, that are probably better references for any kind of violation with a communicable disease. So imminent health hazard. So this is the change for the written emergency operational plan. The only thing we want to make you guys aware of that it is specific to an interruption, an extended interruption of electricity or water. So if you guys can actually work on a written emergency health operation plan of what you would do in case of this situation, you guys don't have to close as required in the previous rule. The health program is going to approve it in the case of this situation, be it a natural disaster or something just goes wrong within the food establishment to where there's an interruption. You guys can continue to operate by implementing that plan. Just understand that it's not pre-approved. You guys have to submit that. Excuse me, it is actually pre-approved by the regulatory agency. You want to make sure you submit this and it has approval. You just don't want to implement without letting the regulatory agency know, because like I said, then you'll probably run into some conflict. We don't have too many examples on our webpage of these plans. However, we're going to start looking at some of the other states that have adopted 2017 Food Code already. And as we get some good guidance documents or referencing some other state programs, we'll start slowly posting those onto our webpage if you're interested in writing one of these plans. Please be aware that this is a new rule. So some of the regulatory agencies are fairly small, so they're not used to approving these type of plans, but this, as it is a new rule, this is something that you guys can use from a stakeholder industry side in case of one of these situations happen. So just kind of be aware of that. Subchapter J, this is going to be our private. Did you want to go into more detail with this one, Jaime?
Sure. I think we're out of time. I can go pretty quickly on this one if you want.
Go ahead, sir.
Right, so, yeah, okay. So Subchapter J. So like Jason mentioned in the beginning of the presentation, a majority of the TFER is transcribed from the FDA Food Code. This chapter is one of the few that was written on its own to provide some requirements for those facilities that don't meet the definition of a public water system. So the minimum requirement for that is to have serve 25 or at least 25 customers 60 days out of the year. So a lot of the areas that we regulate may not have that many customers throughout the year and do not meet the definition of a public water system. So old Subchapter J actually had some requirements for testing of the water if they were on their own private water well or private water system. Talking to our legal team, they did mention or recommend that it was best to go along with the requirements set by the TCEQ. So instead of having Subchapter J, we actually refer back to the Texas Administrative Code, Chapter 290, Subchapter F, which talks about those requirements for a transient non-community public water system. So those requirements for sampling for bacteria and some heavy metals and some other elements in the water that is in that Subchapter F that is presented by TCEQ. So again, Subchapter J will no longer be in the new TFER. All the requirements for a private water system are now listed in Subchapter F in Chapter 290.
Thank you, Jaime. And like I said, if there's any confusion with that, like I said, reach out to the regulatory agency. We've answered a few questions with some of our larger health programs about this that actually do some of the incorporated areas within their jurisdictions. However, if you're on a public water system, this is really not going to pertain to you. This is usually the private water wells is where we're trying to fill a gap for food safety to make sure that water is actually potable that's being served within the establishment. So that's the main focus for Subchapter J. So just kind of be aware of that one. And I apologize, I know I'm running out of time here. I'll try to run through the last few slides. The last few slides are just basically on what FDA Food Code looks like, some of the advantages versus Texas Administrative Code. So the FDA Food Code is the 2017, that's on the left. The TFER is actually a document that we've provided as a guidance. So if you actually want to find the actual specific rule, you can actually go into Chapter 228 of the Texas Administrative Code. However, it's not the easiest to read. So what we've actually done, we've consolidated that TAC into an easy to read PDF. So those 30 pages can be found on our guidance page. So if you want to see the Texas specific rules, we've kind of consolidated that TAC language into a one-stop PDF for you guys. And we called it TFER 2021. So some of the advantages, I kind of mentioned it, that the FDA Food Code is designed as a training guide. It's been utilized across the nation into state, local, municipal rules, either by transcription, as we previously did, or by reference. So this is nothing new within jurisdictions. However, its advantage is that it can use some different tools. So it can italicize language that's a bit of an exemption or additional information versus TAC, where it has to stay the same font. So we're hoping this kind of cures some of the confusion when you read TAC, not understanding that that term or that sentence is really designed as additional information or an exemption to the actual rule set. They can actually use what's called small caps to identify descriptive terms within the body of the language, as well as subscript things with the risk category. And we'll talk about also something they call margin taglines to kind of let you know what you're actually reading, and then basically when it goes into a different section. Biggest difference from Food Code and Texas Administrative Code, it is designed in a more of a chapter system versus our Texas registered format, which is a chapter and then subchapter breaking down all the way into sub-items. So it gets a little bit harder to read. However, even though that they're different formats within these guidance document and the rule itself, it's basically a crosswalk. So there should be hopefully no confusion on terms, format of the Food Code, because we mimicked that before in the previous edition of TFER. So when we talk about food in Chapter 3 of the Food Code, it was exactly the same as Subchapter C in food in the old TFER. So hopefully the terms are not going to be different to anyone, because we were using the same kind of terms, same kind of format before. This is what they use. They call this italicis, and then they use a term called small caps, But basically, this is to help the reader understand what he's actually looking at, or he or she's looking at. So for example, I kind of use the clean in place definition here. So the definition is actually CIP1. So that's letting you know what clean in place actually entails. 2 is giving you the exemptions of what clean in place actually is. So they will usually identify that language through italices, just to kind of let you know that, hey, this is not including this. And then they use what's called small caps. So if you look at sanitize, equipment, these are actually terms that are defined and usually going to be specific to either that equipment or to the sanitization process. So it's kind of letting you know that, hey, we're speaking to something specifically. Margin taglines, I think this is one of the great things about the document is it lets you know when it shifts the rule into a different language. So on the right, you kind of have my TFER where I have to highlight and underline just to make sure I'm understanding of the regulation and what we're speaking to. So on the left, it's going to be able to break that up. So when we're talking about time as a public health control and using the 4-hour rule, that's going to be B1 through 4. However, once we skip to C, now you're moving into a time as a public health control for the 6-hour rule versus TAC where it kind of gets smashed together and you kind of get, if you're not paying attention, you're moving into an entirely different subject. They also can subscript. So if you look at the FDA Food Code, you'll see subscripts for P and PF. So this is actually putting a designation on that risk of that citation. So it's kind of going to help health programs as well as industry partners understand, hey, this is a core violation versus a priority foundation, a priority. That way they can assess either corrections or how they're looking at some of the violations that may be notated. Lastly, if you guys didn't catch that resource page in the beginning, DSHS Retail Food Establishments main page is the one there at the top. Our regulatory clarifications and guidances is there in the middle. And then we have our Food Code 2017 to that FDA guidance document that we're going to reference as rule. So like I said, if you have an opportunity to look at some of these web pages, and then like I said, if you have any questions, please feel free to give the Public Sanitation Retail Food Safety team a call. You can shoot us an email. And I just want to let everybody know, if you're not aware, some of you may be subscribed, but we have an email update subscription through Gov Delivery. So in case you guys weren't aware of the TFER update, we actually send out an e-blast notifying those subscribers of that actual rule change. So if you actually go to the main page, you'll see that link there. You just hit that sign up and then add your email, and then you guys are subscribed to the next e-blast. So Ms. Kelsey, I apologize for going over, but do we have any questions from the audience?
Looks like we don't have any questions at this time. So thank you so much, Jason. Please reach out to Jason. Here's his contact information again, but please reach out with any questions, and TRA is a great resource as well. So thank you so much.
Thank you, guys. You guys have a good rest of the day.
You as well.